In the development of the liver, first point is there is a proliferating endodermal bud rising from the ventral wall of foregut at around 3 to 4 weeks, and how this proliferation occur from the two important molecule, that is FGF, that is fibroblast growth factor, and there is the BMP, bone morphogenic protein BMP7. This FGF fibroblast growth factor it is releases from the cardiogenic mesoderm, and the BMP7 is released from the basically septum transversum. See, then this bud has two parts, cranial and caudal part. Cranial part give rise to hepatic diverticulum, and caudal part has two parts, superior inferior. Superior give rise to gallbladder, inferior give rise to ventral pancreas and the sixty duct, or the basically gallbladder duct, gallbladder duct. Okay. Then this basically hepatic diverticulum means that is the cranial part of the bud. Hepatic diverticulum this invades the septum transversum as a cords of hepatoblast. This cords of hepatoblast invades the septum transversum. Now let's see, this hepatoblast can give rise to hepatocyte as well as a cholangiocyte. Cholangiocyte is basically a bile duct cells. Okay, the common marker of the hepatoblast is basically alpha fetoprotein, and if the expression of HNX4 alpha is present, then it will develop into the hepatocyte, and if there is a SOX9 expression, then it will develop into the cholangiocyte. There is a disease that is known as MODY type 1 disease, that is maturity onset diabetes in young adults. Disease type 1, it occurs when there is a defect in the HNX4 alpha. Okay, and after the transforming into hepatocyte, this hepatocyte acquires a specific marker that is known as cytokeratin 8 and 18. Okay, and the cytokeratin 8 and 18 also express in the transition and glandular epithelium, but it does not express in the squamous epithelium. And if you see the expression in squamous epithelium, that it will be a case of malignancy. So please confirm that. And the hepatoblast which under the influence of the SOX then go into the cholangiocyte. It requires two important molecules. First is the TGF beta, and second is the NOTCH2 pathway and the JAGAD1 pathway. NOTCH2 pathway and JAGAD1 pathway it requires, and TGF beta in the expression of SOX9. This hepatoblast get converted into first into the ductal cells, ductal plate cells, then into the bile duct cell, that is known as cholangiocyte. There is important disease associated in this is Alagille syndrome. Alagille syndrome is autosomal dominant condition, and in this there is a notch 2 pathway defect. Notch 2 pathway defect means there is a defective development of the bile duct. So in this case, there is basically a cholestatic jaundice, means obstructive jaundice. So okay, so due to absence or the incomplete development of the bile duct, this occurs. So the some features in Alagille syndrome is basically prominent forehead. We can see pulmonary stenosis, we can see butterfly vertebrae, and we can see posterior embryotoxin, we can see obstructive uropathy. Yes. What are the key pillars in development? Key pillars in development we have to remember in the 4 points. First is anodome. From the anodome, the hepatic diverticulum rises, hepatoblast rises. From that, hepatocyte cholangiocyte arises. And second is the mesoderm. Mesoderm give rise to the septum transversum, which give rise to basically gleason capsule, stellate cells, and the basically the connective tissue framework. Third is basically the macrophage residing in the yolk sac, that is known as Kupffer cells. Fourth is basically vitreous and umbilical veins from the basically sinusoids of the liver. Thank you.